Hi, my name is Barbara Grawl, and I'm a current Indiana State University RN to BSN student. This presentation is on congestive heart failure and the population at risk. At this time, please pause the video and take a short pretest located in the link provided below. After completing the pretest, please resume the video. Objectives covered in this presentation will include: you will be able to understand what heart failure is. You will be able to understand causes of heart failure. You will understand who is at risk for developing heart failure. You will understand the signs and symptoms of heart failure. You will understand how heart failure is diagnosed and treated. You will understand how to decrease your risk of developing heart failure or decreasing your risk of developing a exacerbation of heart failure. You will understand when to seek additional medical help. First, we'll start off with what is heart failure. Heart failure is when your heart has trouble pumping blood because it has become weakened or stiff. This causes your heart not to be able to pump blood efficiently and may cause fluid backup in the lungs and increased swelling in the lower extremities. Heart failure is considered a long-term or chronic condition. Causes of heart failure include high blood pressure, which causes the heart muscle to work harder and causes the heart to become weak and stiff. Coronary artery disease, which causes buildup of cholesterol and fats in the arteries. Heart attack leading to injured tissue, which causes decreased ability to contract and weakens the heart's ability to pump blood. Abnormal heart valves, which can cause the heart to beat harder. Heart muscle disease that includes cardiomyopathy and myocarditis. Lung disease causes the heart to have to work harder. Population at risk for developing heart failure include having obesity, being of male gender, use of tobacco, whether it be smoking or chewing, use of alcohol or illegal drugs, taking medications that damage the heart, such as chemotherapy, having diabetes, having abnormal heart rhythms, having thyroid problems, and having anemia. Signs and symptoms of heart failure include increased shortness of breath with activity, a persistent cough, swelling of your feet, ankles, legs, or abdomen, unexplained weight gain, increased difficulty breathing when lying down, waking up from sleep with shortness of breath and feeling the need to sit up, increased heart rate and confusion, feeling dizzy, fatigued, or have loss of energy, loss of appetite or nausea, and increased urination at night. The diagnosis and treatment for congestive heart failure can vary. It is usually diagnosed through medical history, symptoms, and physical exam. You may have tests that include echocardiogram, electrocardiogram, chest x-ray, blood tests, exercise stress test, radionuclide scans, and cardiac catheterization or angiogram. Generally, heart failure is treated with medications such as ACE inhibitors, angiotensin receptor blockers, diuretics, beta blockers, and digoxin. These medications act in increasing the ability for the heart to pump blood. Diuretics help reduce the fluid and help you get rid of some of that excess fluid. Treatment may also include placement of a pacemaker, implantable cardioverter defibrillator, placement of a left ventricular assist device, and in some cases, heart transplantation. You can decrease your risk for developing heart failure by having lifestyle changes, which include maintaining a healthy weight, stopping the use of tobacco products, eating a healthy diet, limiting alcohol consumption, stopping the use of illegal drugs, and increasing your physical activity. Make sure to take your medications as prescribed by your doctor. Do not skip or stop taking your medications. Weigh yourself daily at the same time, preferably after you urinate in the morning and before you eat breakfast. Also, preferably with the same amount of clothing. Avoid doing activities in extreme hot or cold temperatures. Manage other chronic health conditions and reduce your stress. Participate in rehabilitation groups as needed to maintain your independence. Keep up to date with immunizations such as influenza and pneumonia vaccines to reduce the risk of developing any respiratory diseases. And keep all follow-up appointments with your doctor to be closely monitored for any changes. You may need to seek additional help if you develop increased difficulty breathing, you and your family notices that you have an increase in confusion or trouble staying awake, you develop chest pain or chest tightness, or you have syncopal episodes where you lose consciousness. Please pause this video and take the post-test provided in the link below. Also in the link provided below, you can get additional resources for an action plan provided in both English and Spanish, which gives you some information as if your plan of action for treating your CHF is doing what it needs to do, if things are going well, if you develop other symptoms. It kind of gives you times when you can contact your primary care physician to change your action plan or seek additional medical help. References used in this presentation were through Excelsior Interactive Patient Information, retrieved from Carroll Hospital Center Extranet Patient Education. There are also additional resources available at the Heart Association through the website provided in this slide.